Okay, we're recording now. Sorry about that. So questions will revolve around priorities. Is it the greatest? Is it the least? Is it the most? Is it the first? Those are priority words that you need to be able to pull out of a question. Nursing process questions, which is ADPI. Okay, the expectation in community is that you're able to take your ADPI, say in the clinical setting, and apply it to the community setting. The same nursing process applies, just applying it to a different setting. Okay, levels of prevention, you should be able to identify the 3 levels of prevention with each of the topics we're covering. So what does a primary level of prevention look like for a vulnerable population versus another faith community, which is what we're talking about. This is part of that. So you need to be able to apply those levels of prevention to different concepts. Okay, remember safety first. What's the priority? Prevention levels related to each chapter, the nursing process. I just said that. Levels of prevention in Healthy People 2030 objectives must be reviewed in each chapter. Okay, look at the tables that were highlighted in the lectures. So you need to go back to your chapters and make sure you have taken a look at the levels of prevention box, which is in every chapter, as well as the Healthy People 2030 objectives, which is in every chapter. Okay, and remember, if you get Healthy People 2030 questions, the only correct answers are what are in those boxes. Some of the other answers might sound good and make sense, but if they're not Healthy People 2030 objectives, then they're not correct answers. Okay, so not an all-inclusive study guide, but we feel that the best practice is to review your notes, your weekly lectures. Okay, discussion questions will help as well, or your assignments that you had during this time. So we're covering weeks 3, 4, and 5. Okay, and then obviously you're here for a review session, which is fantastic. We'll be sending the recordings. I've already sent out 2 recordings. This is the 3rd of 4 reviews. And so I'll make sure I send my recording to all your instructors, and they should be posting those. And then if you feel like after you've done all your preparation, you still need some extra help, please reach out to your individual instructor and set up some tutoring before the exam. Okay, anybody have any questions? For all those people that joined a little bit later, please put your name and your instructor in the chat box so I can do attendance and send it off to your instructors. Okay, so let's start with rural and migrant healthcare and cultural considerations. Do you all remember covering that? Okay, so let's read each bullet represents a different topic or a different talking point. So I'd like to just highlight the important things, what I think are the important things to pull out of each bullet point. Don't just study what I highlight. Excuse me. I currently have COVID again for the 3rd time. So anyway, you're responsible for all the information on the study guide, not just what I'm covering. Okay, so what are the consequences, without even reading this, I'd like to make this interactive. What are the consequences of poverty in rural areas? Like, who are the high-risk groups?
Migrants, immigrants.
Pardon me? Pardon me. So the groups that are highest risk are kids, okay, minority, racial, and ethnic groups. It's the second one. Single parent families, especially those headed by women. Okay, so if you're asked about this, what question might you get from this paragraph? Hello, this is for you guys, not me. I'm just I really would like it for you to participate, what kind of question potentially might be asked?
Which of the following populations are
Yeah.
most susceptible?
Uh-huh. Yeah.
I hear this.
Yeah. It also talks about, this paragraph also talks about among the racial minority groups, it states that the Hispanic rate increases the most. So more information, right? And then it talks about educational level. Okay, the number of college degrees remains far lower. So there's another opportunity for a question about education levels, right? The number of clients with degrees is lower than urban residents. Okay, so that puts them at risk, right? And then the last it talks about is unemployment. Okay, we know that unemployment remains higher for people with the least education. So there's a lot of information in that, right? But the topic of this paragraph is reviewing the consequences of poverty in rural areas. How does it affect people? Here's all your information.
Oh,
Okay. Then we talk about the physical demands, you know, working on the farms, working in rural communities is very, very, very demanding. Okay. Physical demands. Sometimes they're working, harvesting crops on the farms 12 to 14 hours a day. Okay. And they take their toll on the musculoskeletal system. Okay. So what kinds of health issues might that present? Well, here we go. Back and neck pain. So back and neck pain were the most common types of chronic pain. Okay, low back pain radiating into your leg, which is sciatica, is consistent with a herniated disc. Okay, so this paragraph is talking about the long hours they work and what risks do they have to their musculoskeletal system. Okay, another risk for rural and migrant is health risks when they don't seek care. What do we know about the rural migrant clients with regards to seeking health care? What do we know?
Lack of transportation
Location.
and
Sometimes
a lot of them don't have transportation.
transportation's a big one, and then sometimes there's communication barriers.
Communication and cultural barriers. So some of them don't seek medical help. They tend to kind of stick to what they know.
Exactly. Yep. And what we're talking about now is what kinds of things, what kinds of issues, what kinds of barriers, what kinds of challenges do they have in which they don't seek care. We talked about this in class. The rural population doesn't prioritize primary care. So a lot of times when they're diagnosed with an illness or a disease or something, it's more at the advanced stages, right? So we know that they have an overall decrease in health status when compared to urban clients. Rural clients are less likely to participate in activities during leisure time, so meaning exercise, right? They have decreased compliance with safety precautions, such as wearing a seatbelt. They don't do screenings, right? And we know this is big. Chronic disease is much more prevalent with our rural clients. And why is that? They don't seek care. Okay. Next is what are the barriers that exist? We just started talking about that. Clients who live in rural communities know each other and they're very familiar with each other. So what happens?
They don't want everybody in their business and they're scared other people are going to know.
So therefore, they may not seek care with really important issues like domestic violence, sexual abuse, child abuse, right? The lack of, we call it the lack of anonymity. among rural communities, which makes reporting a huge challenge. A lot of times we don't know what's going on until whatever issue is happening reaches a crisis state and they end up in your ER. Right? Sexual assault, drug abuse, depression. They just, I'm not sure who needs to mute themselves, but there's a lot of background noise that's kind of distracting. So if you guys could mute yourself, that'd be great. And then of course, come off mute when you want to participate. Okay, so those are the barriers. Okay, now how do we teach primary and tertiary prevention and healthy? What are the healthy people objectives regarding pesticide exposure? Okay, so we're still in the rural health and migrant healthcare cultural considerations. Okay, so you guys, what we need to know is what is primary? What would a primary prevention be with regards to pesticide exposure?
Education
About
the use of pesticides and how to handle it and what to do.
how to reduce your risk.
How
Yep.
to reduce your risks
Yep.
wearing, you know, PPEs.
So this paragraph gives you an example of each. Okay, so we need to know this. Primary intervention strategy would provide education to reduce exposure. That's primary. Okay, secondary would be providing hand washing stations and conducting screenings. Right? Everybody understand why that's secondary? And then tertiary, they have already been exposed to the pesticide, so they're likely showing symptoms of a pesticide exposure. So tertiary would be initiating treatment for symptoms of exposure. Does that make sense?
Yes.
Next is we need to know the cultural considerations regarding the Mexican culture. What do we need to know as nurses? What do we have to understand about the culture? Right? Nurses, we're considered kind of the go-to for everything, right? People come to us for lots of different things, right? And so we need to be respectful of all individuals. This particular paragraph addresses the Mexican culture. Okay. So Mexican individuals, like those of many cultures, expect to establish rapport by talking about personal matters for the first few minutes before they may encounter addressing any problems. Maybe they're wanting to feel us out, establish trust. Do they feel comfortable talking to us? To the Mexican culture, touching as a caring gesture is usually seen as a positive behavior. Okay. So that's what we need to know. Those are the most important topics that that we covered with regards to rural health and migrant health. Okay, so again, I've highlighted things. I'm a highlighter. When I read, I just highlight things that I think jump out at me as wanting as important. But all of this, all the paragraphs are important. Okay, and like I always tell in my review sessions, if you have a really good understanding of the study guide, you're going to do great on the exam. Okay, and if you don't understand anything on the study guide, please go back to your readings. And please go back to your Healthy People 2030 boxes and your levels of prevention boxes in each of your chapters and become more knowledgeable about the topic. Okay, because the exams are developed from the PowerPoints, the readings. I've already said this, but for people who've come in, they're developed from case studies, PowerPoints, the readings, and then we put the study guide together. So the study guide is essentially a summary of what we've been covering the last 3 weeks. Okay, so the next section is vulnerable populations and health considerations. Okay, so we know that families with kids are the fastest growing segment of homeless population. That's pretty significant. And in my time in the schools over the last 20 years, especially in the last 2 years with the pandemic, that is absolutely true with all the issues that have happened. Okay. So vulnerable populations and HIV primary and secondary prevention. Okay, so what should you know about HIV? Whoops. Okay, how is it transmitted? Okay, it's transmitted, it tells you right here, how is it transmitted? Intimate sexual contact, exchange of body fluids, exposure to infected blood, maybe passing it from an infected woman to a fetus. Right, and the other part of this paragraph is first, how is it transmitted? Okay, and second, who's high risk? Okay. So that's what I would pull out of that paragraph. Next paragraph is about homeless adolescents, specifically adolescents. Right? Why are they at higher risk for risk-taking behaviors? And what are those risks? What potentially could those risk-taking behaviors cause? Okay, well, if part of their risk-taking behaviors is maybe an earlier onset of sexual activity, what comes with that? Maybe increase in risk for communicable diseases, AIDS, hepatitis B, and they're much more,
Pregnancy.
pardon me, pregnancy, absolutely. Right, they're much more likely to use alcohol and drugs. So this paragraph is about homeless adolescents and the specific risks they face. Next paragraph is about single motherhood. And what we know is that there is a direct correlation between lack of education and poverty. That's factual. Okay, and the same is, we know that there's a direct correlation that exists between poverty and poor health outcomes. That makes sense too. And this is all about single motherhood. Poor teens are 3 times more likely to drop out of school. Right, when there are programs that assist mom to complete her education, chances for a better outcome for both mom and baby are better. Right, and if they're better, that just continues to improve the health over the lifespan. Right, it is really important, and this is really important. It's really important to keep the pregnant adolescent in school during the pregnancy. Okay. For all of you that keep coming in, that's fine. I'm recording this, but please put your name and your professor in the chat box so I can send out the attendance. Okay, so here's a section about primary prevention in alcohol. Okay, so when we talk, without reading this, what would be some primary prevention items that we could do with regards to alcohol?
Educating them about the effects it has on the body.
Yeah. Dangers of mixing drugs, medications, alcohol, buying drugs off the street. Maybe what kinds of medications are super dangerous that depress the central nervous system when you mix them with alcohol. I'd probably go back and read that section to be able to name a few of those drugs or medications that have an effect on the central nervous system if you mix them with alcohol. And then what are the effects, what can be the effects of community mental health providers? Okay, regarding youth violence. Lots of opportunities, creating partnerships, coalitions, teamwork, task force, working groups to develop, provide education, to increase social skills. We want to teach kids how to stop, think, and act. Okay. And then this last paragraph is about homeless people accessing care. They have the same issues as people who live in poverty. Okay, lack of money, lack of insurance, lack of transportation. You know, fear of immigration issues. So where do you think homeless people are likely to seek their health care?
Hospital.
Emergency rooms.
Emergency.
Right, which does that increase or decrease the cost of healthcare?
It
It increases it dramatically because the emergency room, very expensive. Okay, so that's a section on vulnerable populations. And then the next section is on alcohol, tobacco, and other drugs. And in this section, we talk about ADPI, which is your nursing process, prevention, and safety. Okay, here we tell you to review the Healthy People 2030 concerns with tobacco and the objectives. So you need to go back to that chapter and you need to review the Healthy People 2030 box in that chapter. Okay. We know that tobacco use is preventable. It is preventable. So we also need to go back to that box, the other box in that chapter with regards to primary, secondary, and tertiary, because we know it is preventable with regards to tobacco use. So how do we develop programs for number one, primary, which is education on the risks, secondary, which is screening to see who's at risk that we need to target, and then tertiary would be somebody who already smokes or abuses alcohol, and we're helping them with management or elimination or treatment. Okay. And then here's an important question to be able to answer. What are some of the risk factors? What are the risk factors that cause abuse with alcohol, tobacco, and other drugs? What are risk factors? What do you think?
Dysfunctional family.
Stress.
Heredity, maybe some heredity in that? Peer pressure, mental health issues, poverty, lots of risk factors. Okay, so here we're asking you to go back and review how your psychological dependence can occur with chronic use and what drugs are safer than others to use. Okay, so that's something you need to review in that chapter. And then you need to be able to articulate what is harm reduction? What are the benefits of harm reduction? What is harm reduction? We're trying to reduce the risk factors, reduce the harm, right? So what are those benefits? Okay. And the last question here is, what are considered risk factors for the vulnerable to cause alcohol, tobacco, and other drug problems? These questions are all answered in your PowerPoint lecture readings. So you need to be able to articulate those. And I tell my group, I try and review or at least highlight the objectives for each chapter. Okay, because the objectives say at the end of this chapter, you should be able to, and then there's lots of explain, describe, list, there's all these things, all these objectives. That's how we base our presentations on, because we follow the book, right? That's our teaching tool or part of it. And so I like to go through things in the book that cover objectives. Okay, because that's where the meat is. Okay, you certainly don't have to be reading every chapter from start to finish. I start with the objectives and base my lectures on meeting the objectives. So at the end of the chapter, you can articulate all the objectives. Does that make sense? And that's how we build this study guide as well. Okie dokie. And then it's important to know nicotine ingredients. What do you know about that? Do you know what kind of teaching you would provide on vaping products and exposure? So go back to the section, that chapter. If you can't answer that question here, go back and read that about nicotine. Right? What teaching? Couple things to find out. What teaching? If you don't remember or know, or you haven't read it, what would you do to teach on vaping products and exposure? And then the other question to answer is, what would be some primary and tertiary points for teaching and prevention? I'd probably add secondary to that. So I would go to your primary, secondary, and tertiary box for that chapter. And be able to answer that, articulate that. Okay. Next topic we discussed was the faith community nurse. And in conjunction with that, we talked about faith community nurse, home health, and hospice nursing. You need to know the difference between, there's two models of faith-based nursing. It's the congregation-based and the institutional-based model. Can anybody tell me what those are?
Congregation is autonomy and are the parish nurse, and the institutional are they are no independence. They will be under a hospital law or
Partnership.
yeah,
Right.
partnership. Okay.
Right. So you will get a question about this, so you need to know them. Congregational, exactly what the student said. It is confined to the congregation itself. So the nurse is working within the congregation only. She is working at the direction of the leadership of whatever it is, a church, a mosque, whatever the leadership wants her to do. That's congregation based. You're just working with the congregation. So you might be doing maybe health fairs or well child visits, or a lot of education, a lot of teaching, a lot of bringing the spiritual aspect of care to the congregation. Okay,
when the institution based is
hi Erica.
Oh, sorry. No, I was doing
ahead.
a lot of things while I was listening. So then the institution based is like hospitals, like not faith based.
So you're halfway.
Is that like
Yeah. So
based on faith? So like institution or like hospitals, clinics, non-denomination, anyone can go there, right?
Yes. So institutional based is the leadership of your congregation decides that they want to provide more services. So they will partner with hospitals and clinics and transportation and Meals on Wheels and all these other things. So once you move out from the congregation model into the institution, it's kind of a community setting. There's lots of different partnerships, within the community to help with your particular congregation.
So like you said, that's what I was going for. The
Yes,
community,
exactly.
it's more community partnership than it is
Yep.
within the congregation.
Yep, So congregation is limited to the congregation only. Institutional, it moves out into the community for assistance. So if they want to contract with physical therapy, home health care to do, wound visits or medication visits. So institutional it branches out to the community. Okay. What are some of the spiritual activities a parish nurse would do? There's a nice little box in this chapter that describes what they might do. We've already talked about a few of them. A lot of education, a lot of preventative care or interventions, right? So go back and review that box in this chapter about what are some of the spiritual activities. I mean, what do you think of off the top of your head? What are spiritual activities that would be added into the care? Maybe praying together. What else? Maybe reading religious passages.
Would there be like more holistic care too?
Yeah, it's definitely more holistic, spiritual and holistic. Absolutely. Okay, next, how does a faith community nurse act as an advocate and a case manager for their patients? Excuse me. First of all, define a case manager for me. What does a case manager do and what is her role? All of you that currently work, go ahead.
A case manager usually have access resources for patients, whether it be home health, it could be a lot of number of other things. And a lot of them are nurses, but then they have the social worker who are not nurses.
Exactly.
So one of them able to access the medical side of it, which
That's
is not
perfect.
necessary.
That's perfect. So they are the coordinators of care. Okay, so a lot of times the faith community nurse is acting as a coordinator of care, which is a case manager. Okay, because a lot of if they're working out of the institutional based model, they're having to coordinate care. Maybe it's back and forth to a doctor's office, back and forth to a hospital, back and forth, to social events, the rec center, exercise. Okay. This paragraph also addresses Healthy People 2030. Okay, so I need for you to go back and review the Healthy People 2030 box in this chapter. Okay, we're asking, what are the differences in levels of prevention of faith community nurse practices? Okay, and she's following Healthy People 2030. So there's two boxes to review. Well, you should be reviewing these in every chapter anyway. And as you can see, it keeps coming up in the study guide. Levels of prevention and Healthy People 2030. If you're going to go back and review anything in these chapters, it needs to be those two things. Okay? What's the difference between religiosity and spirituality? And can you provide examples? This is right in your reading.
It's like following a doctrine versus what's making you happy.
Okay, that's a good start. So religiosity is focusing on a specific religion, whatever the religion is. Or spirit. Go ahead.
I said religion is the one they have doctrine. How do you say in English? I think it's doctrine, like, when they have like a rule to follow up, and a spirituality will be in your own terms, I believe in God, but I know, especially you won't have like a congregation meeting, you won't have like a reading scriptures, things like that, like everything is free.
Great. Yep. So religiosity is focusing on your particular religion in your congregation with the same group of people, where spirituality is the bigger picture. Do you believe in God? What are your beliefs spiritually in general? Okay, you need to go back, if you already haven't taken this from your notes. There are 5 functions of hospice nursing. Okay, and provide examples of each. Does anybody have that written down in your notes?
Palliative care, home health, hospice. And I don't know, I'm missing one.
Yes, you're missing one, but yes, that's exactly. I believe this was one of our attestation questions. Remember?
Yeah,
Is
Okay.
the other one the direct and indirect?
Yep. Yep. So go back to your attestation questions. 5 functions. There's 5 of them. Okay, care plans and the nursing process. Okay, you should be able to, ADPI, you should be able to identify a step in each of those. What's a step in assessment? What's a step in diagnosis, planning, intervention, evaluation, right? So the important thing is by steering the conversation towards goals, right? The nurse is able to work with the client to identify mutual outcomes. Okay, that makes sense, right? We want the patients to be part of the assessment. And this is step out of your clinical role with the patient in the hospital. You're out in the community now. Okay, so much more of an opportunity to include the client, the family, significant other in identifying outcomes, goals, outcomes. Okay, so this paragraph talks about nursing process in the community setting. Review the requirements of Medicare coverage. So you need to understand the difference between Medicare and Medicaid. Okay, with regards to number 1, skilled nursing care. Okay, because one of them covers skilled nursing care, the other doesn't. Okay, so for example,
That's Medicare, right?
pardon me?
That's Medicare. The
Correct.
skilled nursing, that's Medicare. Okay.
Correct. Yes. So what is skilled nursing care? So skilled nursing care is not somebody going in doing ADLs or personal care services, right? Skilled nursing care would be going in to say change a dressing or teaching family members how to give an injection. Okay, it must be skilled. Okay, right here, sitter services and assistance with ADLs is not sufficient.
So like RN task.
Is it
Is that, would that be correct? Like is.
Yeah.
Okay.
Skilled nursing care. So the only, just exclude ADLs, personal care services. Those are not, that's not skilled nursing care. Next paragraph is about Medicare. Again, who qualifies or what's the difference? Okay, so let's read up to here. Pretty simple. I think of Medicaid. Here's how I think about it. Being in school nursing, there's a lot of families that don't have education or insurance. So I always got confused with the two of them as well. I always think of Medicaid as aid. That's how I thought about it for families, aid for my families. Okay. So, and it is financially based. Okay. It's based on financial resources. Okay. So families qualify for Medicaid, which is aid based on financial need. Okay. Where Medicare is for the older adult. Okay. But there's 2 things: over 65, and this is really important, or disabled. It doesn't matter if you're an infant or a teenager or an adolescent. If you are disabled, you go to Medicare along with the older adult. Okay, that's the difference. Okay, go back and look at one of the, in your home health section. What are some of the assessments a home health nurse accomplishes during a home visit? We know that home visits are the best kind of visits. What kind of assessments can we do in a home visit? Let's just say you're going there to help them organize their meds or doing a quick wound change. What other kinds of assessments can you do other than assess the wound,
Do a safety assessment.
safety assessment, environmental assessment, home assessment? Are there other people in the home? How's the communication? How are the kids? Is everybody screaming and yelling, or is everybody calm? And okay, so lots of different, there's a box in the chapter for home health of what kinds of different assessments a nurse can do when she's in the home. Okay. Okay, our last section is environmental health and epidemiology. So you need to know the definition of epidemiology and how it applies to infectious diseases. Okay, so please know the definition of epidemiology. Okay, everybody know what the agent and host and environment represent? What does that represent?
The epidemiology triangle.
Yep. And what's the epidemiological triangle?
Is the agent, host, and environment,
Right?
the cycle.
Yep. Yep. And so all three have to exist, right? And there's many ways they interact with each other. There's a lot of ways. Okay. The agent, depending on the significance of it, the host, is the host healthy? Is the host immunocompromised or not healthy? Environment. What factors in the environment? Is it a high school classroom or is it a nursing home? And all those different interactions between the three of them, there's so many. What we call that is the web of causality. That's just it's a complicated word, but it means it just all these different interactions create this big web. Okay,
What's mean?
pardon me.
What is mean web of causality?
Web of causality is kind of a summary of all the different interactions that these three can do.
Oh, okay.
Okay, so if the agent is, say, COVID versus a flu, okay, let's say the agent is a COVID, okay, the host is all of us. Okay, well, I've just got COVID for the third time. Okay, I'm somewhat immunocompromised because I had radiation for breast cancer in the last couple of years. So I'm already compromised, right? So I've got it for the third time. All right, so I'm probably not as healthy as you guys are, right? So more susceptible. And then the environment. Well, my environment when I think I got it is when I flew last week. So I put myself in a high risk environment, flying on an airplane. Does that make sense?
Yes.
So that's right. But think of the other scenarios. You know, the agent is COVID. And I'm looking at Erica because I can only see a few people. She looks healthy to me. Okay, so she could probably fight it off better than I can.
I am
Right?
feeling much better from having COVID.
Yeah. And she's probably not on a plane. So Erica's in a much better position than I am. And there's just multitudes of scenarios. Rakia is probably, if Rakia gets exposed to COVID, I don't know Rakia's health history, but she may sail through it. She may not even get it. Does that make sense?
Yeah.
Okay.
It will be the predisposition of the people, of the host.
Yeah. Depends how infectious is the agent? How healthy is the host? And what's the environment look like? I mean, what do we
Like
find?
my son is immunocompromised and it hit him pretty hard.
Yeah.
So, but my other son, his twin, I mean, he was down with a fever, but not,
Right,
he
exactly.
wasn't as dehydrated or any of that. Yeah.
Put expose COVID in a high school athletic classroom and then expose COVID in a nursing home. Okay. You need to know these. I'm going to get going quick because I have to teach in a few minutes, but please know these. You're going to be asked, you're going to be given a scenario of one of these. Okay, case fatality rate. Know about the case fatality rate, right? Case fatality rate, think about it. Fatality rate is the number of people diagnosed with a particular disorder, and then those who die. So let's say, what's the case fatality rate of breast cancer over 5 years? Okay, so let's say, let's keep reading. The case fatality rate is considered the estimate of risk of death within that period of a new diagnosis. Right? So often people that I wanted to know when I was diagnosed with breast cancer, what's the chance I'm going to die in 5 years? Okay, so they gave me a case fatality rate, 5%. So that's what that is. Okay, and then this talks about individuals with immune deficiencies are at higher risk for illness, especially if they're exposed to contaminated water or food. What are some other examples of immunocompromised people? People with AIDS, people on chemo, organ transplants. Here's a good tip. Review Healthy People 2030 for environmental health. Go back to your environmental health chapter. Go to your 2030 box. Make sure you know what it says. What's the role of the occupational health nurse? Okay, what are some primary prevention strategies on how to reduce environmental health risks? Go find your levels of intervention box in occupational health. We just discussed this, review the principles of the triangle. Okay, and this is in your epidemiology chapter as well. You need to know what the definition of incidence, risk, and prevalence. What is incidence? The chance it's going to happen, right? What is risk? How at risk are you? What's the risk? Are you immunocompromised? Are you not? What's the prevalence? How often is it happening? And then there's a few epidemiological study designs that you need to know the definition of. One is an ecologic, one is a cross-sectional, and one is a retrospective. I know I've got some of my class coming in early, so just hang tight. I'm finishing up with a review for my RN class for the exam. So don't think I've started and you're missing anything. Okay. And then lastly, know the function of Osha. This is in your occupational health chapter. Right? What's Osha? OSHA's, you know, we get, every state gets federal guidelines for work, safety at work, right? OSHA enforces those. We all work in places where everybody flips out when OSHA's coming to do a visit, right? If there's been a workplace injury, if there's been something environmental that's funky, you're going to get a visit from OSHA. They're the ones who come out and evaluate the standards. Make sure you're complying with them. Okay. So that's your study guide. Helpful?
Yes.
I'd like to go right to the study guide. If you can't answer what's in the study guide, go back to your chapter. Okay. And again, if you have a good understanding of the study guide, you're going to do fine on the exam. I promise you. Nobody ever believes my promises, but I promise you. Questions for me. My next group, hang tight. I'm working with another class doing an exam review, so you're not missing anything. For all of you that just sat in on this exam review, please put your name and your instructor in the chat. Okay? So you can get credit. Okay, actually, for the few students I have that are going to be my upcoming class, I'm going to end this meeting so I can end the recording, and then I want you to log back on again. Okay?
Thank
Is it-
you.
Yeah, you're welcome. Does anybody have any questions? Has this
I
been
was gonna ask you a quick question, but
Go.
I didn't realize that you had another class
That's
coming
okay.
in. So no, I was it's private, so it's no big deal. I
Okay.
can just send you an email. That was
Send
it.
me an email.
Okay,
That'd be great.
no big deal. Okay.
Has this been helpful to you guys?
Yes. I actually wanted to ask you math questions, like more or less, like what should we focus on?
It's in the first page of your study guide. Let me let's see. Hang on.
Nana.
Somebody mute themselves. I don't know what's going on. Mute. Just go to the first page of, I'm just trying to share my
Yeah,
screen.
I
real
found
quick.
it.
Okay, good.
Thank
Those are
you.
the questions. They're pretty simple. They're simple. Simple
Okay, thank you.
calculations. Okay. All right. Well, I'm going to go. If anybody's any questions, feel
Thank
free
you,
to email.
Professor.
You're welcome. You're welcome. And good luck on the exam.
Thank you.
Okay.
Thank you.
All
Thank
right.
you.
Talk to you later. All right. For all my group, I'm ending this so I can get the recording stopped, and then I'll be right back.